that I'm so excited for you all to learn about today. And let me go ahead and invite them all on. Alrighty. Hello, Tracy. How are you?
Great. I love when technology is seamless like that.
No, I was like, get a little bit nervous while like who comes on and is who's watching in the meantime. Tracy, thank you so much for joining us here today. I'm actually calling in from CCRM, where I'm one of the surgery center nurses. I'm actually sitting here.
Supporting your logo.
There we go. We have CCRM New York, one of the leading fertility clinics actually in the country. So much we could talk about CCRM today.
So much.
I'm so excited to talk with you. Also, I just wanted to let you know, and for all of our viewers as well, I'm currently sitting in Dr. Jamie Notman's office. She's all present, all here, all of her pictures. She unfortunately couldn't join us today, but she would love to join us in the future for future phone calls. She's the chief medical officer at Chick Mission, and she's one of the leading partners here at CCRM New York and the director of fertility preservation. So she just wanted to say a quick hello via me, but hopefully she'll join us moving forward.
I can totally see pictures of her little girls in the background. So
they're the cutest, Blake and Charlie. So Tracy, thank you really again so much for joining us today. I would like, if I could just give a brief intro about who I am to the Chick Mission followers, and then if you could talk about a little bit about who you are, your involvement in Chick Mission, when we'll get into what is Chick Mission, and we'll bounce off from there. So just for everyone to know, I'm Kimberly. I'm one of the surgery center nurses here at CCRM New York, Colorado Center for Reproductive Medicine. I've been here now for 3.5 years, and I'm going into my 5th year working in fertility medicine. It's truly become a passion of mine throughout my nursing career, helping women all across the nation, even across the world, with the beauty of telemedicine nowadays. And my role as a nurse here at CCRM is I assist the physicians when it comes to the embryo transfers as well as the egg retrievals, which is all the different steps in the process of IVF and egg freezing. And there's so much that is involved in the process. There's so many details in what it is that we do. But today I want to focus in on the beauty of fertility preservation and the nonprofit Chick Mission. So before we get into all of that, Tracy, can you please do us the honor and introduce yourself?
Absolutely. My name is Tracy Weiss. I serve as the executive director of the Chick Mission, an organization that was founded by supporters and survivors who believe that women with cancer should be able to preserve their fertility ahead of battling this disease, something that most insurers don't cover. So I am a survivor myself. I had uterine and cervical cancer 2009, 2010. And met with a woman named Amanda Rice, who most of the Chick Mission folks know. She had cancer 3 times before her 40th birthday and had the same experience. Despite having fertility coverage through her insurance company, she was denied. It was considered elective. So we came together with, I'm going to say, some badass women. Can we say badass on Instagram Live? Who had all been touched by cancer in a different way, whether they lost a parent, whether they lost a friend, or they experienced it themselves. We decided to do something to change the landscape for women's reproductive health when it came to oncofertility. We had very little idea what we were doing. Most of us come from either a finance or marketing background. I myself used to work in media, but we read Nonprofits for Dummies and had a can-do attitude, gave our first grant helping a patient financially freeze her eggs before she started treatment on February 14th, 2018. And as of this morning, we've helped 311 women.
Wow, that is amazing.
Thank you.
May I ask just a little more in details, how did you decide to get involved in the Chick Mission, with the Chick Mission?
Well, Amanda Rice is a woman who knows a million people a million different ways. And she got in touch with me through a mutual friend and said, hey, I'm thinking about starting this thing. Do you want to go to lunch? I absolutely thought that she was going to ask for a donation, But instead, we figured out that I'm the weirdo creative with words for everything, and she's the strategic math thinker. And we're kind of two sides of the same coin when it comes to working through this field that is hopefully going to stand up for the women who come after us as cancer survivors.
That's incredible. Wow. I didn't even realize that the Chick Mission has only been around for now 4 going on 5 years. That is so much progress that your team, your company has made within the past, like just since you've gotten started.
So thank you for saying that.
So how, may I ask, how can people get involved with the Chick Mission, and, what are different fundraisers, or what is it that the Chick Mission will do, let's say on a day-to-day basis? Or maybe before we get to that, actually, forgive me, if we could backtrack in terms of the struggle of, like you've told me in the past, we don't choose to get cancer, but all of a sudden we have to choose to get our eggs frozen. What is the disconnect that is going on there?
Something that most people don't know is that the treatment that will save your life will likely render you infertile. I had no idea that you were born with every egg you're going to have. I had no idea that chemotherapy can affect both the quality and quantity of your eggs. Radiation surgery, especially to the midsection, has the same effect. And especially for breast cancer patients, 57% of which our Chick Mission grant program is made up of, the long-term drug therapy, the hormone therapy that a lot of these patients go on will age you out of your natural reproductive years. So if you want to have children after your cancer chapter is closed, which, by the way, 90% of women who are diagnosed with cancer during their reproductive years do go ahead and live long, happy lives.
Incredible.
And think about that quality of life. So if it's something that you're not sure about, you want your future to have children, you really don't have a choice whether or not you have to freeze your eggs. It's really the only way to guarantee that you'll even have a chance to try after cancer. And I think that the other thing that people don't know is insurance companies do not cover this procedure in most cases. 7 years ago, there wasn't a single state that mandated insurance companies cover this. So the Chick Mission has 3 separate functions. The first is education. We have, whether it's a women's club panel or Instagram lives like this, we want everyone to know the difference between oncofertility as well as fertility 101. Because it's important that you know how your body works in case you have to make very quick decisions about your health and your future. The other is through advocacy. As I mentioned, it's state by state that need to make changes to their legislation to mandate that insurance companies cover this. And even when there is coverage, there's still loopholes where many patients, unfortunately, have to come out of pocket for their fertility preservation, which anyone watching may not know is anywhere from $10,000 to $20,000. Most people do not have access to that kind of cash in the 12 days, in the 2 weeks you have to go through this procedure before you start your actual cancer treatment. And that's the part that's just unbelievable to the Chick Mission. This is day one. You are completely blindsided with a cancer diagnosis. I was 30 years old. I thought that cancer was something that happened to old people. There was no family history. So in addition to worrying about my own mortality and my community, I then had to make an immediate decision on whether or not I could freeze my eggs financially if I wanted to, and then you start treatment. And as I alluded, the third leg of the stool, as Amanda would say, is our HOPE grant program. We have a need-based program for women to apply for financial assistance to have their egg freeze and their fertility preservation covered.
That's beautiful. And it's really true what you say, is that oftentimes when I'm seeing patients who are coming in to freeze their eggs, little backtrack I'm going to go on to is that little lesson in Fertility 101 is that us women are born with all the eggs we'll ever have. I always say that it's really unfair for many reasons that men are producing sperm until the day that they die. But with us women, we are born with all those eggs we'll ever have. And that number just continues to decline as we continue to age. And especially once we hit our 30s into the mid 30s, that fertility slope goes down like that. A good little cute, I would say, meme that I saw about fertility is kind of like that one of my fertility doctors once mentioned is that our fertility is kind of like a gumball machine, is that every month that knob turns and then the gumball comes out and we can't put another gumball in. Our body's not creating more eggs each month. So
And
when we're
sometimes there's two gumballs.
yeah, yeah. And then while we're losing those eggs each month, and then they get with like a diagnosis such as, like you were saying, a uterine diagnosis, breast cancer diagnosis, you have to make quick decisions. You don't have the time to think, oh, maybe I'll freeze my eggs next year, or maybe I'll freeze my eggs, you know, if I'm not where I want to be, let's say at the age of 33, 34, 35, maybe that's the time I'm going to freeze my eggs. This could happen, like you said, at the age of 30. I'm 30 years old. And to find out one day that you have a diagnosis and the next day it's like, okay, wait, not only do I have to think about my immediate future, but now we have to plan ahead. If I want to have kids in the future, it's all of these big decisions at once. I can only imagine how difficult those emotions are and what's a process, and then to be burdened with the financial component of it. I know nowadays we're moving forward where a lot of companies are offering egg freezing as a benefit to join the company, and that's incredible. But I do think that you've mentioned this to me in the past, we don't elect to get cancer. We shouldn't have to just elect now to have that option to freeze our eggs.
And I think that that's the portion that we don't speak about. We talk a lot about cancer treatment can damage your reproductive system. We talk about that we didn't elect to have tumors, so why is fertility preservation elective? But the whole other part that's emotional. I think that most people are not necessarily sure what they want their future family to look like, especially at a young age. And then you're just barraged with decisions. You are absolutely underwater with what kind of chemo am I going to have? You know, which surgeon should I go with? You know, do I tell anyone at work? And all of these things are very valid. And when you're going through an IVF cycle, when you're dealing with infertility, that is a struggle. So if you think about that emotional struggle and put it on fast forward, that's the onco experience, because you don't have time to emotionally figure out how you feel about the situation. You don't have time to fiscally plan. And what Chick Mission tries to do is take one element of this off her shoulders. We've all sat in that waiting room. We all know what it's like to just be spinning. You know, if A, then C, then B, then Q. And if freezing your eggs, the financial burden of that is taken off your shoulders, it's one less thing that you have to worry about before you start focusing on getting well.
It's amazing. And I mean, I've had a number of patients here at CCRM who have gotten the grants from the Chick Mission, and they are just forever grateful for that opportunity, because like you said, it's not easy just to have, you know, an additional $10,000 in an emergency funds for an emergency such as this, which it truly does become an emergency when you have to think about your fertility in the future. I have a question for, let's say, someone who does receive a diagnosis and they do know of Chick Mission, but they may not know which fertility clinic to go to or which physician to see. In addition to consulting with their oncologist, which I know a lot of the times oncologists talk to patients about fertility preservations and options, does the team at Chick Mission have a select group of doctors that they recommend, or do they like to leave that to the providers to direct them to like a physician?
Yeah, the Chick Mission has, we call them kind of dedicated fertility partners in 6 different states: New York, New Jersey, Illinois, Colorado, California, and Texas. And you can get referred to, let's call it a Chick Mission partner clinic, in 2 ways. Either your oncologist says you need to have fertility preservation, here's a list of who the Chick Mission works with, or I recommend you go see so-and-so. The other way, the more common way, is that we often get a direct message on Instagram, or a inquiry on our website, or an email to our hope@thechickmission.org asking that exact question. And then we always say, it's really important to me personally that people have options of who they see in their geographical area. Cancer takes away so many of your choices. You should be able to check with 2 different REIs and see who you're comfortable with, and see if this is the right place for you to go through a very emotional and physically taxing journey. So I always respond, and usually it is me, with the names of our fertility clinics that are specific to your geographical area. For example, New York City is our home city. We have 7 different clinics that we work with. I always put them in either alphabetical order and then switch who's on the top next time to keep it fair. So we never send one patient to one specific clinic because I want them to be able to choose. So for example, if CCRM is one of those clinics, I would put the name, their website. I would do the same for RMA. I would do the same and all the way on down to let the patient decide where they'd like to go.
And that's the beauty of these states that you've mentioned before, is that they're, in these metropolitan cities, there's an abundance of reproductive endocrinologists that these patients see. So that's great. And it seems that there's already so much work that has been done, connecting with, you said it's 7 or 11 states, I apologize, that you work with.
It's 11. It's kind of, we kind of joke it's 10 and a half. There's 10 states that have legislation mandating insurance cover fertility preservation. And in Utah, it's specifically for patients on their Medicaid program. So
right.
That's very rare. So it's 11 states, 10 and a half, depending who you're asking.
Okay, that's true. And I would say there's so much work that has been done, but there clearly is so much more work that needs to be done. And I am I'm so excited to see, in the next 5 years, how far the Chick Mission goes to further help more and more women all throughout America, maybe the world, just, learn about their options, learn about, hey, I don't know where to start. Now I know where to begin.
Yeah, not power. And some women may not choose to use their eggs after they have cancer. Maybe they decide they don't want a family. But it's about giving people the choice before cancer makes the choice for them. And I think that that is a very powerful thing in a world where you wake up one day and you're a healthy woman, you're a career chick, sometimes you're a wife, whatever you are inside, and all of that gets eviscerated in the single minute you hear you have cancer. All you are is a patient. And this allows you to take some control back over your body, over your future, over your own decision making. And I think that at the end of all of this, that's all the Chick Mission can offer, is taking back control of your own care and help you learn to advocate for yourself and what you need.
I think there's one of the most important things in this world is female empowerment and feeling empowered with our own decisions as an individual, as a society. And what you and Amanda and the entire team at the Chick Mission are doing is really remarkable. And I'm so grateful that you've come on the platform today and spoke. We've had a number of people come watch. We're going to post this again. I'll post this onto my page so more people could continue to hear our conversation if they missed it this afternoon.
I mean, I definitely put makeup on then if it's going to live on your feed.
You look
Kidding.
And I'm just so excited to continue to learn more about the Chick Mission and hope to bring you on in the future. And so we can continue to learn from you and from Amanda. Just a little thing for all my followers to know as well is I'll be at the Chick Mission Gala next week. I am so excited to such amazing women all across New York City and the country. And I'll definitely be, sharing some of the speeches, if that's okay, or information that we're going to be hearing next week. And yeah, is there any thing that you would like to add before we, say goodbye for now, or any last?
Yeah, I think that 2 things. One, if you are watching and not in the New York area, you can absolutely follow Chick Mission and keep a close eye on our silent auction. There's some incredible things that, of course, all proceeds go to our Hope Grant program. But also, if you have any questions about Fertility 101, ask Kimberly. You can ask me, and if I don't know, I'll ask Kimberly. And I think the more information you have about your own body, it'll allow you to make informed decisions and also be a resource for your community who might need you. If I had a friend say, hey, you should probably think about freezing your eggs before I was 3 months into a bunch of procedures and, all kinds of diagnoses,